NBC's Sahil Kapoor is on Capitol Hill for us. NBC's Dasha Burns is outside a middle school in Durham, North Carolina, where there are growing concerns about the number of new cases among children. I also want to bring in Harvard Medical School's physician, Dr. Aditi Nerurkar. Good to see all of you. So, Sahil, this news conference from Republicans seems, I think, to be the biggest, most organized shift we've seen in tone and messaging. You do wonder, though, how much of the party is where they are, and is anybody going to listen?
Yeah, Chris, there is still certainly a split within the Republican Party about this, but there is a growing recognition that they have a very important role to play in trying to convince that skeptical 30% of the country that still hasn't gotten the vaccine. Why is that? A couple of reasons. Firstly, those 30% predominantly identify as Republicans, as rural residents, as white evangelicals. That is the core of the conservative base, and we know from data that people can be persuaded, if they are resistant, to ultimately get the vaccine if they learn things, if they hear things from trusted sources about the safety and the efficacy of the vaccine. So people like Steve Scalise, the #2 Republican, who you just heard there, he's trusted by a lot of people. He could have a role to play. Elise Stefanik, who stood with him, the #3 Republican, has also done some events and given some remarks recently encouraging people to get the vaccine. On the Senate side, there is a split. Senate Republican leader Mitch McConnell has been clear and consistent about the importance of vaccines for a long time now, but there are other members of his caucus, such as Ron Johnson of Wisconsin, who have trafficked in misinformation. So how far the shift goes remains to be seen, and I will add this press conference with the members of the Republican Doctors Caucus. It did start off by talking about China and its role and kind of criticizing Speaker Pelosi for not doing more to investigate the origins of COVID. So there is still that element of red meat there. But there is a shift, Chris, and I would not be surprised if it does have an impact in terms of convincing some people to get this vaccine.
Well, Dr. Nerurkar, that's the key question, isn't it? How many people out there who haven't gotten vaccinated are still persuadable? I will tell you, I've never ceased to be amazed as I've traveled the country talking to voters, the ones who praised Donald Trump for Operation Warp Speed that actually ended with the development of these vaccines, but they themselves don't trust the vaccine. It would seem to be a disconnect. How many persuadables do you think are out there, and do you think that these Republican members of the leadership can have some influence?
You know, we've seen with study and study again that when trusted individuals in the community speak up for the vaccine, this can have a profound impact on vaccine confidence and vaccine enthusiasm. We know that there's a clear red-blue divide, a 30-point differentiation between Republicans and Democrats when it comes to vaccine enthusiasm and risk perception. But now the tide is turning. There's a greater sense of urgency. These issues are becoming much more pronounced because they are in these people's backyards, and it's no more an obtuse external threat. You know, it's hard to argue that COVID is a hoax when large proportions of ICUs around the country are filling up with young, healthy, and largely unvaccinated people.
Well, let's talk about the young people. Dasha, where you are, Durham, North Carolina, nearly a third of all new cases are among kids 17 and younger, which is a devastating statistic. What are you hearing from officials there about this surge in cases among kids?
Yeah, Chris, the numbers aren't good, and they've changed pretty rapidly here. Just last week compared to this week, North Carolina has seen a 32% increase in cases among children under the age of 14. And this comes at a really precarious time for schools as they are making their plans to get kids back in the classrooms in the fall. And in fact, here in Durham, there are children that are already back to school as they have year-round education here. So in this middle school behind me, there are kids in classrooms at this moment as we're seeing this surge. The governor acknowledged this yesterday at a briefing, and he issued new guidance to schools saying that middle schools and elementary schools should require masks regardless of vaccination status. But he said that for high schools, if people are vaccinated, they could take those masks off. But Chris, at the end of the day, as much as these guidelines are strongly recommended, it's going to fall down to the district, to the local level. And as we know, we've seen this become a flashpoint in school boards across the country. And it's not yet clear if or how the state would enforce these rules in those districts that are more hesitant to mask up. Meanwhile, here in Durham, they're actually taking it a step further. Durham Public Schools is requiring masks in high schools as well, regardless of vaccination status. So masking up across the board. I spoke to the Durham Public Schools Chief Communications Officer about this. Take a listen.
We're all in on masks right now to help protect people who are not yet vaccinated or who are not yet fully vaccinated. The sooner everybody has the vaccine in their system, we're close to normal now. We get closer to normal with every shot in every arm.
They've also implemented new air filtration systems. They're trying to socially distance where possible. But, Chris, the vaccination rate among those children who are eligible, the 12 to 17-year-olds, is quite low in this state. It's just about 24% fully vaccinated. And the message from the district is, if a 12-year-old is vaccinated, they're helping protect those younger kids who aren't eligible, and they're hoping that families will take that into account, Chris.
And there's this tragic story, Dr. Nerurkar, as we see more kids get sick. We see kids dying of COVID. There's a 5-year-old Wyatt Gibson from Georgia. His family provided this video. He had no underlying conditions and died of COVID. How concerned are you by this increase in young people getting COVID right now? And what should every parent know?
I'm very concerned, and that is why the American Academy of Pediatrics just last week set a new set of guidelines encouraging masking for all children greater than 2. And we're hoping that the CDC really takes this into consideration in the coming weeks. We have 5 weeks until the first day of school, and largely most school systems are unvaccinated ecosystems. We have 48 million children under the age of 12 who by definition are unvaccinated. Between the ages of 12 to 15, only 25% of children are vaccinated. And from 16 to 17, in that age group, 37%. So by my math, we have 66 million individuals who are under the age of 17 in the U.S. who are unvaccinated. And masking does offer the greatest safeguard at this time.
No place in the world has as much accessibility as we do right now for getting vaccinated. And if you live in New York City and in a lot of places, it seems like on every street corner I can get tested if I want to. But there was just this minute, Dr. Nerurkar, Jeff Zients was in the briefing, the White House briefing of the COVID task force, and said this: 3 states, Florida, Texas, and Missouri, just those 3 states account for 40% of all cases worldwide. What are we doing wrong?
That is a million-dollar question. We've had multiple missteps nationally because of the wide discrepancy in COVID cases. We now really need to focus very coordinated in a deep way to make sure that these states that have largely unvaccinated people, get people on the ground, get people to speak up who are leaders, all of the things that we've talked about today to really make an impact. I think we can do it. We are starting to see a change in the tide, but it has to be a deeply coordinated effort on all levels.
Well, obviously there's a lot of politics involved in this, right, Doctor? Just this morning, though, the Atlanta public school system announced it's going to require masks for all students and staff when the school year starts. Virginia health officials late yesterday announcing that they believe all elementary schools should require all students and staff to wear masks indoors, regardless of whether they're vaccinated or not. And obviously, we're still in the situation with these young kids not being able to get the vaccine. Do you, have any hope? Do you have any anticipation that the politics of this and the hesitancy to put these requirements in place is going to change? Is that what's needed? Are we at the point now where if you don't require things, we've already gotten as far as we're going to get?
I am incredibly hopeful. I think once we start recognizing, and we are recognizing, that this has a tremendous impact on all walks of life. COVID is a bipartisan issue. It has always been a bipartisan issue. The virus does not discriminate. Unfortunately, right now, what we are seeing is that it is targeting unvaccinated people, most of whom are Republicans. So we really need to band together to make sure that all people are vaccinated. And we do have, like you said, we have free access, 3 vaccines that are very effective against the Delta variant at this time.
One quick correction, still a shocking number, but I want to make sure that we clarify this. Florida, Texas, Missouri account for 40% of cases nationwide. Dr. Aditi Nerurkar, Sahil Kapoor, Dasha Burns, thank you.